If someone is recommending you get major dental work, we're talking implants, full mouth reconstruction, bone grafting, pretty much any large treatment plan over $10,000, I highly recommend you get a second opinion. And the reason is not that we don't trust your first opinion, it's just you want to make sure that everybody's on the same page with what your options are and what might be the best treatment for you. And I always encourage my patients, if they have any questions, if they're not 100% on board, please get a second opinion, get a third opinion. I think the more dentists that look at it and inform you of your options, the better you're going to be. I'm Dr. Brett Langston. I'm a prosthodontist and the owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia. Let's talk about when to pause, what questions to ask, and how to do this right. First of all, not every dental decision requires a second and third treatment opinion. A lot of times there are very straightforward solutions to a lot of simple dental treatment. But what I'm referencing is the bigger, more complex solutions where there might be 2 or 3 different ways to do this. So if you need a filling, you really don't need 3 consults to confirm that. When the treatment plan is extensive, when someone hands you a treatment plan with multiple procedures, multiple timelines, or a total that looks like it's a phone number, that's a great moment to step back and just take a moment before you commit to anything. That's a big decision. Also, when the recommended treatment plan contains irreversible procedures, whether that's shaving teeth down, extracting teeth, placing implants, doing bone grafting, that's also time to pause and make sure this is the right decision. Anytime a procedure changes your anatomy or the way you look, you are entitled to be absolutely certain before you proceed. So, when something feels rushed and you feel under pressure to make a decision, that's not necessarily a red flag about the dentist's office, but it is a time you should take a step back and pump the brakes and make sure you're making a smart decision. None of these situations mean that there's anything wrong. We do large treatment plans every day, but we also want to make sure when you're doing a large treatment plan, you take the time to make sure it's the right decision. So here's something patients don't often think about before undergoing major dental work. The dental decision that you make today is something that you're going to live with for a long time, decades probably. Things like multiple implant restorations, full mouth reconstructions, bridges that involve multiple anchor teeth are going to have an impact on what your options are down the road. And not just 5 or 10 years from now, we're talking 30 years down the road. And also, it does limit what options future dentists can do when you have problems down the road. So this does mean that the cost of getting the treatment plan wrong is not just financial, which is real, but also potential problems down the road for corrections and what's possible in your mouth because of what you did in the past. I'm not saying this to make you anxious about every procedure or even big treatment plans. I just want you to be aware of the implications of what you decide to do today is going to have an impact on what's possible tomorrow. Unfortunately, a lot of patients think of dental care as like a haircut or something that just is not a big deal. You need to make sure a lot of times what we do is permanent and that has implications on the future. So here's something that we learned in dental school and I learned in my prosthodontic residency that no one ever really explained to patients. In dentistry, there's often more than one correct viable answer. In fact, the running joke is if you see 10 dentists, you'll get 11 different treatment plans. But in all seriousness, most of my patients that have complex dental issues, when we sit down and look at their options, we can come up with 2 or 3 very equal, very viable, great solutions that any one of those 3 would be a great choice. A lot of times that can feel very overwhelming. And so that's why we're here to sit down with you and walk through each step and make sure we make the right decision for you. You can absolutely have 2 well-trained, ethical prosthodontists look at the exact same patient, same x-rays, do the same screening, the same diagnosis, and come up with 2 very different defensible treatment plans. One might prioritize preserving some teeth longer, and the other might recommend removing those teeth and moving to an implant-based restoration sooner. One might sequence procedures differently, have a longer waiting time between stages. Neither one is lying to you or trying to upsell you. It's just they've seen what's worked in their hand and their experience guides them to believe that their treatment plan is going to be the best for you. So a second opinion isn't necessary to say, oh, that dentist was wrong, you need to do it my way. But sometimes what it does reveal is that 2 very smart people can see the same situation very differently. And that context will help you decide which approach aligns with your priorities, your timeline, and your tolerance. I want to take a second to talk to the people watching this who feel weird about this, who feel awkward about getting a second opinion. And maybe getting a second opinion feels like you're cheating on them. Totally understandable, but at the end of the day, it's your mouth and you need to make sure you're comfortable with the treatment plan. Let's actually reframe that. A confident clinician, one who actually believes in the plan they put together, will absolutely welcome a second opinion because they know that you're going to get confirmation that what they provided for you makes sense. It's not an accusation of your dentist's ability, it's just your due diligence for your mouth. It's the exact same way that you would review a contract before signing it or get a second quote on a major house reconstruction project. Honestly, if you mention that you'd like a second opinion and the response makes you feel guilty or awkward, that's really useful information about the dynamic in that relationship. It's not actually about the dentist's competence. You should definitely feel like you have a partner in your dental care. That is not asking too much. You decided to get that second opinion. Here's how to make it useful. Always go in fresh. Don't come in with saying, my first opinion said this, or they think we should do this. What do you think? Let the dentist come up with their own solution and their own treatment plan. You don't want them to have an influenced read or opinion. You want them to have their own independent, educated treatment plan. Don't just compare the price. You need to look at the reasoning for why each treatment plan has proposed what they propose. Because while one may be more expensive, if the other one is more comprehensive and takes care of your needs, it's obviously a better solution. Definitely ask them why this plan doesn't include addressing this, because you need to make sure at the end of the day, whatever plan you go with is a comprehensive solution to your problems. The next thing you want to do when comparing the two plans is look at the sequencing. Does the sequencing make sense? Is there a logical step, order, and pattern to everything that's going to follow? And if something feels out of order, ask about it. Any dentist that I know that loves their patients and loves what they do absolutely welcomes questions. We want you to ask questions because the more questions you ask, the more informed you are. And the more informed you are, the better the outcome is going to be. So ask this specific question at both appointments. What happens if I do nothing for 6 months? And how that's answered is going to actually tell you a lot. I've built my career by treating patients who've trusted me with major life-changing work. Smile rehabilitations, full mouth reconstructions, treatment plans that have taken 2-3+ years. I can tell you without hesitation, the ones that I love the most are the ones that asked a lot of questions and had all their concerns addressed before we even started treating them. A second opinion is just a part of that process. It's not necessarily a detour. It's just you making sure you're making the right decision for your health. If this was useful to you, subscribe below. I do this every week. Drop a question in the comments if you've ever been handed a big treatment plan and weren't sure what to do with it. I'll see you in the next one. I'm Dr. Langston. I'm here to help you watch your mouth. With a smile shine bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.